I literally wish I could individually come and take care of all of you guys if that was possible. Dang it, let's figure out how. So open heart surgery, love that one. It is one of my most challenging days when I have it, and I absolutely love it. Obviously, I wish it was under different circumstances that I meet you guys when you guys are having open heart surgery, but I do know that I am proud to be the one taking care of you. Come and greet you, and I'm gonna make sure that you have a large bore IV. Sometimes it is I who puts in your first IV for the day. I at least try to get an 18 gauge at least. I'm gonna take you back to the operating room. Sometimes I start your IV out in the preoperative area, kind of depends on the facility that I'm working at and the rules there, but sometimes I need to start your vancomycin out in the preoperative area and start rolling you back. I had a little itch. We get into the operating room. Obviously, I've talked to you the whole time. Before we go back, I've talked to you and your family out there. I do whatever and answer as many questions as I can for you and try to give you as big of a heads up as I can about what to expect. So I do give you an anti-anxiety medicine as we roll back to the operating room. It does kind of make you guys feel a little loopy. And sometimes it is difficult for you guys to move over to the procedure table once we get in there because you are so drunk. But that puts me at ease because I know you are at ease, and then we start doing things. Once we move you over to the procedure table, I am going to start placing my extra IV lines and arterial lines and central lines. So the first that I'm going to place is what's called an arterial line. It goes into your artery instead of your vein, and it allows me to monitor your blood pressure every single time your heart beats, as opposed to a blood pressure cuff that has to go off every 3 to 5 minutes. I can also draw blood easily off of that line, arterial blood, and be able to send it off for gases during the surgery and monitor your blood levels and chemistries and all of that during surgery. I do use skin local anesthesia there to place that arterial line. It's not super uncomfortable, but it can be if I don't numb it well, so I make sure to numb it. Then I go to the head of the bed and get ready to induce you with anesthesia. I have worked in the past. It is me inducing your anesthesia, and I am there. I have several drugs in line, and I am ready to push them after I have let you breathe oxygen for a couple of minutes. And I pay attention to lab values, your baseline blood pressures and all that jazz. I have to make sure everything looks good. Important big thing about inducing anesthesia on a heart patient is that their heart is very fragile. So basically I need to do what's called a smooth induction, and I cannot allow your blood pressure to change whatsoever with induction. And you say, well, that doesn't seem difficult, but actually it is, because all of the drugs that we use to induce with anesthesia actually affect your heart and how it pumps. Not necessarily in a bad way, but it just does. And I cannot let you do that because your heart has blockages. That's why you're having this surgery, and I cannot let your heart go under any kind of stress. An induction of anesthesia can be somewhat stressful on your body. The normal human would not know, but nor would it make a difference. But if you have a sick heart, it could. So I gently and in a matter-of-fact way give you certain drugs, recipe, perfect for you, and then I induce anesthesia and gently place the breather tube.